Yep.
Okay. You said one is a subset of the other. Is
Yes,
that the
please.
right way of saying it?
Yes, please.
That massage
Is
is a small bit of
physiotherapy. Physiotherapy is broad.
Okay.
Yes, please.
Do each of these have a particular purpose? I don't want to throw away the word massage because, you know, everyone goes for massage and do they have
Different
what
purposes?
are the purposes of each of these?
For physiotherapy, what I would say it's more of rehabilitation. And then for massage...
That's a new term
yes.
that you have introduced, rehabilitation.
And then for for massage, it's more of relaxation. For example, I've been overworking and I have tensed muscles and I feel tension or lactic acid has accumulated in my muscles. I'll go for massage. And unfortunately, most of the massage parlors, they don't have people who have done anatomy and physiology. So at the end of the day, some people end up being hurt in the massage parlors because they don't have that training. How do I move this muscle? Which blood vessels pass here? Which nerve passes here?
Does
So
it matter?
it does. For example, I've had, no, even before my own example, we remember there is the time when Dr. Garuhanga, Moses, or something like that, he was talking about someone who was also a doctor who was prescribed to go and see a physiotherapist. Then he ended up in a massage para. So at the end of that day, they amputated his leg because he just had a back pain and sciatic nerve pain. And the way how they manipulated him, it was really bad, and they ended up damaging the sciatic nerve, and then it costed his leg. And then I've also had patients whereby they, maybe in Mulago, they've told them go for physio, they go for massage, and then they come in when they are really badly off. So why? Because the people who are doing massage, they're not trained to do it.
But I thought you said in your training,
We do it.
you also include massage. So I assume that those who are trained in massage and they work in massage parlors are part of you.
Not really. Unfortunately, it's not.
So you mean to say a person who does massage is not necessarily a physical therapist?
Yes, please.
But
They
a
are
physical
really-
therapist
Yep.
can do some massage, is that
Yes,
right?
please. Yes, please. We can, because it's a small cost unit that we do, so we can do it. But it shouldn't be like broad term like physio is massage. They are totally different professionals. And in Europe or developed countries, you'll find that there is a massage therapist, someone who's specialized in massage, and then they don't do physiotherapy at all. You just go in, they do the soft tissue manipulations, they help with the circulation, then relax you. But those people have studied anatomy and physiology, so they know how the body moves. Yes, please.
It's important for someone to know if I do this, I might damage this.
Yes, please.
So I can avoid it. Now, if someone presents like this is what I do. Is
Yes,
that
please.
right? Rehabilitation, massage, and physiotherapy. What's the difference?
For rehabilitation is the same as physiotherapy, because in rehabilitation we deal with more of the exercises. And then how can I, for example, you come in handicapped. How can I help you to attain activities of daily living without maybe, for example, you have an injury? How can I help you? The process of helping someone who is ill or has an impairment or has disability, to help them attain activities of daily living, that is rehabilitation. And then for rehabilitation, it involves a lot of things psychologically. That's why we need a psychologist to be part of the rehabilitation. For example, in stroke patients, someone, maybe they've lost their arm, maybe they cannot sit, maybe they cannot walk. That frustration alone, they can enter into, maybe they into psychological issues, and then they cannot do rehabilitation. So we need in the group of rehabilitation, we have speech therapists, people who will help this person to speak. For example, in stroke patients, you've lost your speech. Then we have occupational therapists. For example, you come in and then the arm is dropped. You have a wrist drop. So rehabilitation, as a physio, I'll come in and do stimulation, do exercises, but the occupational therapist will be able to help you. How can I use this hand, even if I have a wrist drop?
You know, we started with a few words. It was massage, physiotherapy.
Then we
Now
have
there's
to
occupational therapy.
Yeah.
Everyone thinks an occupational therapist helps you to get a job.
Not really. For us in the medical field, it's this person that helps you to attain activities of daily living. For example, as I was explaining to you, the hand is dropped, or you have a disability. How can I move around? How can I do this without calling for help? You know, like, for example, if you are a father, you're a breadwinner at home, and then you've lost your arm. How can you bring food in the house with your disability? So that is what the occupational therapists
And that is not physiotherapy
no,
now?
we are totally two different professionals.
That's
Yes.
very interesting. And are there particular conditions that will need a physiotherapist?
Yes, please. We have a lot. For example, we have neurological conditions where we have stroke being one of the leading neurological conditions in Uganda. It's among the non-communicable diseases.
Okay.
We have cerebral palsy in children. For example, your child is born who cannot walk, they have delayed milestones. So those are the neurological conditions. People with Parkinson's disease, which is called Ibuko here in our Uganda kingdom.
Shaking disease.
Shaking diseases. And then we have the neuromuscular skeletal, which is more of the
Now you're speaking a lot of medicine.
yes, that's why I need to break it. So we have the low back pain, we have the chest pain, we have the arthritis. Arthritis, I think most of the people have heard about it.
When people have joint diseases.
Yes, joint diseases. And then we have the arthritis. For example, you've been playing football or you've been kicked in the back, so you have more of musculoskeletal, which is muscles and a skeleton. So that is one other group. Then we have people, pregnant mothers. We have, that is obs and gynecology. So we do antenatal physiotherapy to prepare this woman to give birth. And then we have, on each trimester, we have different exercises that we give this lady who is pregnant. For example, strengthening the pelvic floor muscles so that you don't have urinary problems, urine incontinence. We have, after giving birth, we have the postnatal. How do I go back to my normal shape? How do I look beautiful? Yeah, so that is under that. That's obs. And then we have the post-orif, which is more of operations.
Post what?
Post-orif, which is post-operation.
Okay.
Yes, for example, people with fractures.
Oh, okay.
Yes,
Okay.
you've had a fracture, then we rehabilitate you back to normal. And then people who have laminectomy, which is surgery on the back, still we will help that person to get back on their feet. Yes, please.
I have just realized that some of these terms are too hard for us.
That's why I'm simplifying.
Laminectomy.
That is surgery on the back.
Okay.
Yes, please.
Yes.
People with craniotomy, brain surgery, still we can help you.
Now, would someone, you know, when you have muscle stiffness, you walk into a massage parlor. How do I walk into a physical therapist clinic?
Without a referral? Is that
Do I have
the
to be
question?
referred?
Not really.
How do I know that Dr. Dung might need physiotherapy?
Okay.
Me as a person.
Yeah. So Dr. Dung, maybe, for example, you've spent a whole day in theater. If you do operate, then you end up maybe bending your neck for a long time. So you have stiffness in the neck or you have a sore back. So sometimes you can just walk, you can call your physiotherapist if you have. If you don't have, you can go on the internet, search, and then you read about it, and then you go to a physiotherapist. So for us, physio, we can diagnose as well because we study medicine. So you can come in, I assess you, and then I say this is your condition. Sometimes I have to refer you to an x-ray until you go and take an x-ray to see if you have a disc prolapse, if you have a nerve which is trapped, all that. So we can still refer patients to do that.
So you're going to get a person who walks into your facility.
Yes, please.
Evaluate them.
Yes. And then I will know the problem. Then if they need, for example, if you come in and you have a stroke, for example, you've seen a physio center and you're like, let me go in to
I have a relative
physio.
who got a stroke.
Yes, let me just go in. Then you will come and I assess you. If you are really badly off, I'll call a neurosurgeon because we work as a team. And then I'll say, maybe, Dr. Joel, I have this patient. Do you have an appointment so that they can see you? So that you first see a neurosurgeon and then you can come back to me after their assessment. Yes, please.
This is very interesting. And for some of you who have just joined in, actually, the program is U-Health Chat here on UBC TV. And we have a special guest, Irene Ndagire, who is a physiotherapist. She said she's also called a physical therapist, but she has subspecialized into cardiac
Therapy.
I think you're going to tell us about that.
Yes,
so that people
please.
understand whether you need to get out their hearts and then do physical manipulation, or you're going to do something different.
Yes, you're right.
You know, when someone hears cardiac therapist, and we all know cardiac means heart,
Yes, please.
we're like, let's go slowly here. We're going to take a short break. And when we return, we are going to continue with our discussion to understand, especially what a cardiac therapist does, and maybe you could be having conditions that might require physiotherapy or physical therapy, and maybe massage when we return.
Inspirational moment with Pastor Jackson Senyonga of Christian Life
We
Church.
shall trample over serpents and scorpions. Tunalinyirira enchaba n'emisota. Otambula mu maaso nga bw'olinnya tolinnya ng'oli wamu awo. You tread as you walk forward. You don't stay stationary. Agenda kufuka amafuta ge. He's anointing. Ku bigere ebyo. On your feet. Obeere nga bali abasajja abalina ebigere nga ababiri. And you'll be like the two lepers. Bwe baatambula nga bagenda mu nkambi y'abalabe baabwe. When they walk towards the camp of the enemy. Emisinde gyabwe nga giringa abasajja 5,000 abalumba. Their footsteps were like 5,000 men strong. That's why the Bible says whenever you step with your feet I've given to you. You shall have dominion, you shall not be dominion. You will take captive, you will not be taken captive. When I look at you, I don't want to see how the devil has been working in you, but I want to see how the Lord is working.
UBC TV is the only public broadcaster of choice.
We inform, educate, guide, and entertain.
We bring you news as it is, wherever it is happening in real time.
We take you far away places, from border to border.
We keep you up to date wherever you are.
In the languages of Kiswahili, Luganda,
And English.
UBC TV,
Inspiring Uganda.
Welcome back. This is U-Health Chat here on UBC, and I'm Dr. Dungu. I have a special guest, Irene Ndagire, who is a physiotherapist. Before we went for break, we're talking about some of the conditions that might require a physiotherapist. And there's something that many of us have heard about, and I know we might get a chance to talk about it.
Yes, please.
A condition called sciatica. You tell us about what it is. And then a condition, I don't know if it's a condition, echibafu. Okay, hydrotherapy.
Therapy, yes.
Yeah? You know, we had a lot of issues, and I may not go into those issues, but maybe you tell us about sciatica and then hydrotherapy.
Okay. Sciatica means it's a condition that attacks the sciatic nerve. What is a sciatic nerve? Because the other person
Where
might
is the sciatic nerve?
The sciatic nerve, it's the longest nerve in the body. It travels all the way from the brain. It's one of the cranial nerves. Then passes through your neck, your upper back, then it comes out in your lower back. So it comes out from L1 to S1.
We don't know
Okay,
those things. Yes.
So it passes through the buttocks, which is more of your bottoms. Then it reaches the hip. It divides into 3 branches. One will pass on the side, and then in the middle, and then behind.
Okay.
And then it reaches the knee joint, and it divides into different branches. You'll find that this lady, maybe she's sleeping, or you are sleeping, and then you get like a muscle pull, or you get pain. And these days, before I go there, these days we find that most people have pain on the left leg. Do you have any sciatica, you yourself?
Well, I think I do, because what you're trying to describe, unless if I got it wrong, but it looks like you're saying someone has pain,
Yes.
including when they're sitting and they feel
Yes,
pain.
yes. And that nerve, most people these days, you find it on the left side. left. It's which leg drives? It's the right. Most people have it on the right side. Why are you getting sciatica on the left? Because, for example, if I drive a long journey, I'll use more of my left, then I'm pressing on my nerve on the buttock. Remember, this one is lifted up, so you are putting all the pressure where the nerve passes in your bottoms, and then we end up with numbness, electric shocks, burning sensations. Some people, even they don't feel their leg. For example, if you walk out of the car, you say, oof,
The
you
leg
get
is
it.
all paralyzed.
So that's sciatica, the condition. How can we address it? How can we treat it as physical therapists or physiotherapists? So for us, what we will send you for an X-ray to see how your spine is. If it's not, we'll refer you to an orthopedic surgeon. Either you take an MRI or you do an X-ray. Most cases, maybe the nerve is trapped from your lower back. You will find patients who will tell you, I don't have any lower back pain. You get it? But the leg is paining me. That means the nerve is trapped, or it's compressed on from the discs on your X-ray. So what do we do as physiotherapists? You will come in maybe with severe pain. I will use a stimulator to help to ease the pain in the nerve. Okay? Then I will use infrared therapy to help with circulation and then relaxation of the muscles, and then I'll do exercises with you. There are different stretches that we do to ease the nerve or to reduce tension on the nerve. And then we add in hydrotherapy. What is hydrotherapy? Maybe you wanted to ask about that.
Hydrotherapy.
Or aquatherapy. Aqua means water. So as physiotherapists, we are trained to do rehabilitation in water, exercises in water. So we believe that water, because there is no gravity, you remember the rule in senior 2, which is in physics, viscosity, and then buoyancy. So in water, there is no gravity, so you are able to stretch more than on land. On land, because of the gravity, you will not be able to stretch the leg.
Oh.
Yes.
So you mean because of the
Buoyancy and
Yes.
viscosity. So you are able to stretch more in water, and then you ease your nerve very fast. Then we do different exercises when we are in water. We'll do back, even if you
would
don't.
you recommend me to take
Of
a
course.
swimming lesson? For
Not
example,
really.
if I have sciatica.
I would recommend that will be awesome if you're a swimmer, but if you're not a swimmer, I would recommend you do therapy, because there are exercises that we do in water. After training you, it's a 4 weeks program. I'll train you those exercises, then you adapt them. When you go to the swimming pool, you can do a lot. You do your swimming laps, and then you do your exercises, and then you live a healthy life. You know, even it will help to strengthen your heart, your lungs, and everything. So we recommend people to do. And it's interesting, as you said, there are people who are swimmers who will tell you, me, I swim, but they still have the sciatic pain because they are not stretching. They will just go in water, and then you do your laps, and then you forget
Without
about
stretches.
without stretches. So there are specific exercises that we do in water. Yes.
Irene, people talk about the wallet, like men.
Yes. Yes. The
What do you have
wallet.
to say about that?
Even the wallet will cause.
You know, have a wallet with a lot of cash or with a lot
cash
of
or
business
money.
cards.
Yes. So what I forgot I was supposed to talk about it. Thank you for bringing it up. The wallet, because when I put a wallet maybe on my right side, that means my right side will go lower, and then there is a change in your posture. For example, for a long time, you'll end up getting structural deformities, and then you end up compressing on the nerve. Or for example, I'm going to drive a long distance and my wallet is here, and remember you are sitting on the bottoms where the nerve passes, still you will end up compressing it. So we really advise people, if you sit in offices, if you are walking, try to empty your wallet or remove it from your trousers and
Put
just
it
get a
somewhere.
handbag like women.
That'd be a good one.
Yes, so that you don't end up with a sciatica. But at the same time, people who have arm pains, many people who carry heavy luggage on their bags or bags, they end up with shoulder pains, they end up with nerves that radiates through the nerve pain or the arm pain radiating through their arms because of lifting. For example, if I lift the bag, especially women, there are women who will carry even Bibles, novels in the handbag. So let me tell you, my friend, you are going to change your posture, then you compress on the nerve. That's where we end up with the shoulder impingement. So because of the posture. So let us work on ourselves, mind about our posture, we sit straight, everything we do.
Looks like everything we do is terrible to our lives.
Yes.
Even the wallet, even the handbag.
Yes, please. So for the women, I would advise you don't hold a heavy bag, please.
Okay.
People who carry laptops, get it should balance it should be balancing on your body, and not all the time. For example, even at home, most of us, we end up with laptops. Then we sit up in a bad posture. For example, you sit on your bed and then you end up slouching. In that way, you are compressing on your spine, you are putting tension.
So how should we sit?
You sit straight, upright, whereby your shoulders should be straight. Sometimes if you are sitting in office for a long time, tuck in your tummy. In that way, you are strengthening your back muscles, because the lower back is brought about by very many postural problems, mechanical. It's more of mechanical. If you have a weak abdominals, they will affect our back. So tuck in as much as you can. If you are answering a phone call, stand up instead of sitting for 8 hours. Then at home, get a corner, then get pillows to support you. Put your laptop up on a pillow so that you don't end up slouching. Yes, please.
Now, you talked about hydrotherapy as a way of trying to make life easy for stretching.
Ourselves, yes.
There was, there is, these manipulations of the hands, of the feet. It was so much associated with
reflexology. Was it more of that?
Reflexology.
Yes.
How is reflexology related to physiotherapy?
I'm sorry to laugh about that. Reflexology, for them, they believe that everything is controlled in the feet.
Oh, they're not part of you?
They are not part of they are not under orthopedics.
Okay.
Yes, and for us physio, we are under orthopedic department, so we believe everything is controlled by the brain.
Okay.
For example, they can cut off your leg or amputate it, and then you can still reason and you do your work. But you knock yourself on the wall, you become a garbage or you're destroyed. So I don't have much to say about that. So for me, what I would recommend, I would stick on what I know. So let us...
I am glad you've brought it out, because we used to confuse the two.
The two of them.
Saying that if you have this, just go and
they touch your feet.
Yes.
But remember, if they cut off the feet, you reason very well. If everything is controlled by the feet.
I see. And when they cut off your head, no, we'll talk about that later.
Yes.
People are using different oils for massage.
Yeah.
How good are those oils? Or do we actually have to use them?
Yes, we have to use them because they make it's more smooth. I cannot start massaging you without oil. There will be friction actually if you just massage. For example, in pregnant women, we don't advise oils. Someone sits on the table, on the chairs behind, then the husband just rubs to help with the circulation and reduce the pain in the back. But for others, there is also what we call trigger point release.
Okay.
For example, you have tension in your muscles. I'll use my fingers without oil. But if you need just the normal massage, I would recommend you use an oil to just reduce friction and then just smoothens, and then you feel relaxed.
These are special ones?
For me, I can say any oil can work. What I would advise our viewers, just warm that oil. When you warm it, for example, if you're at home, you warm it, it will help with the circulation very fast and then relaxation. There is olive oil. It's really good for massage. And then cooking oil, I wouldn't recommend that. But still, it's oil. For example,
boiling.
if you are in pain, you will use it, but it will be smelling on you.
People might wonder why.
Yes.
What's going on?
The lavenders, there is basil oils. There are different oils that they sell out there that can really be used for massage.
Okay.
Yes, please.
I go into a physical therapy unit and I want a massage. Can it be provided?
It depends
For
on
example,
the
if I
physiotherapist.
went to Sonia's,
Sonia Physiotherapy. If you come in, still I'll work on you, but most cases I will find a condition in you. For example, you will come and I assess you. You'll tell me, I just need massage and I feel okay. I'll come and say, what's your name? I'll go into subjective assessment. Then as we talk, and I have to manipulate you first, the bones to move and see if they are not stiff. Then if they are not stiff and then the muscles, you don't have any pressure points, then I'll just tell you, you don't need massage, go and exercise. But if there is tension in your muscles, still, of course, I'll go ahead and just do gentle massage to help you. Okay. Yes, please.
So for tension, massage works.
Yes.
If I have neurological deficits,
Conditions? Yes, please.
for example, someone has weakness on one side,
The stroke.
then we use...
For stroke, we use different modalities. We can do massage to help to reduce on the tightness of the muscles, because sometimes it's really painful. For example, if someone walks in with a stroke and the arm is stiff and the elbow is stiff, the fingers are crawl like this, it is painful. So when you do massage, you help to relax the muscles, and then you are able to do your exercises. You are actually able to manipulate more and do joint movements if you do first with gentle massage. Yes,
I think I'm getting it clear now that massage is a subset which can actually help with better manipulation.
Yes, please.
Is that a right assessment?
It's a soft tissue manipulation.
Soft tissue manipulation.
Yes, please.
And that if I do that in water, it might even be better.
Better.
What you call aquatherapy.
Aquatherapy, yes, please.
Or hydrotherapy.
Yes, please.
Wow, there are lots of things that I keep learning every time I listen to people like you. And I am sure you out there, you are also learning a lot of things. We really want to make sure that we prevent further damage. So, again, I was saying, how do I know I need to see a physical therapist or a physiotherapist?
Okay.
I don't want to wait for a stroke.
Yes.
Can't I do things that will stop me from getting that?
Yes. I always say control your weight in your kitchen and become fit in gym.
Say that again.
Control your weight in the kitchen and then become fit in the gym.
What do you mean?
What we eat matters a lot. For example, obesity. If you overeat and you don't control your weight, you'll end up with a stroke. And then there are different types of stroke. We have hemorrhagic stroke, which is your blood vessels rupture in the brain, they break.
You know, when you go into stroke like that and everyone is interested, we are going to take a short break. When we return, we are going to discuss more of these conditions where we need physiotherapy and massage. Please don't go away.
This weekend on UBC.
But in particular, when we talk about cancer amongst girls, always start at the age of 9. Because when you hear what happens around the world now, girls tend to grow older quickly.
Youth tend to think that cancer is a disease for parents and grandparents, but they're more and more...
I mean, I thought that for a long time,
Yeah.
even when I was growing up. But
Your best man should be someone who's trustworthy. First of all, someone you can entrust your secrets with. Not someone who's going to talk about you after your wedding or before or whatever is happening.
A best man is a person who must stand with you with that relationship.
You are the best man of Pastor Bujingo. Previous, not the current one. Is he remarried?
You cannot keep two people together who don't want one another.
He decided he's going to marry, and he has already almost introduced. Then what else can you do?
You cannot take back the blood you shared with that woman. Because the divorce would be separating the two. You cannot separate.
He is against the biblical teaching and the doctrine that he is teaching.
Welcome back. It is U-Health Chat here on UBC. I'm Dr. Dungu, and I'm with Irene. We are discussing physiotherapy as a modality of treatment, and actually went through a number of conditions where physiotherapy can be applied. You told me to sit like this so that I don't get problems.
With your upper
so
back.
now I have to learn how to sit properly.
Yes, please.
If I come in for a physiotherapy session, what should I expect? Should I come in with a lot of painkillers? Do I need anesthesia to undergo this? What is involved?
Because most people always think physiotherapy is painful. Actually, torture. Sometimes some people always think that. But physiotherapy is not torture. It's lovely if you embrace it. For example, you walk in with a lot of pain. We have different modalities that can help to reduce the pain. We have electrotherapy, where we will use infrared to help with the circulation. If you've just got an injury, I will use ice to help with circulation and reduction of the pain. And then we will use some gentle exercises to help you. Where people come in with physio and they say, oh, physio is very painful. For example, someone walks in, has had a stroke or tension in the muscles, or has had back pain for years and years. They walk in, they expect a miracle because maybe they've told them Dr. Dung is the best physiotherapist. So they walk in expecting to get fine in one day. It's like running a marathon. When you run instantly, when you've not been exercising, the following day you will not move. Why? Because lactic acid would have accumulated in your muscles. We've had patients, they come in and then they are fine, you do exercises with them, then the following day they say, I'm worse, or I'm really doing badly off. Why? Because you started with exercises, you expect the body to react. So what we advise them, if they call in and they say, Irene, you know what, maybe I did physio and then I feel more pain, we'll advise them get a warm water bath or a cloth, just massage around, just, you know, those things we do, and then you do some gentle movement. At the end of the day, someone calls and they say, oh, it helped. Then I'm able to come in my second visit. Yes, so that one is expected, especially if you are to deal with soft tissue manipulations the first time. Someone will feel the tension, will feel lactic acid, and then they will say physio is very painful.
So they'll feel pain?
Actually, some will say, I didn't feel anything actually, because I warn my patients. I always tell them, maybe tomorrow you'll get some pain, nakanyama. In our Uganda it's like muscle pains, but don't say I'm not going to do physio. That is expected because you've not exercised in a long time. You've been with this condition for a long time. But if it happens, do ABCD. Or if it's really severe, take a paracetamol to just help you to ease the pain. Yes, please.
So not just avoiding going back.
Yes. When you avoid going back, that means you're going to stay with your condition for a long time. We've had patients with stroke, then you move them the first time, for example, the arm is subluxed. Maybe it's out of the socket, and then you move it, then they have a lot of pain. Then that person will say, I'm not going to do physio again. But they don't know that they're bringing a burden to their tenants. They are going to be dependent because they will be in pain. So let us focus on getting independent. If you are doing physio or going for physiotherapy, focus on getting independent as much as possible than dependent. And then we've had patients who walk in and they say, they've been doing physio for years. Then you tell them, you know what, you don't need to come every day. Maybe you need to go to the gym, do these specific exercises. Once in a while, if you feel you are tensed up, if you feel maybe you are stiff, you can come in for bone manipulations and then exercises, and then they are dependent. There are those ones who are dependent on physio.
You brought in the issue of a gym.
Yes, please.
Which one should I choose? Should I choose to go to the gym or to a physiotherapy facility?
First go to a physio, because they will tell you which exercises to do. In the gym, you will find, unfortunately, us here in Uganda, we don't have trained people who have done sports medicine or who have done sports science in the gym. In Makerere, they teach sports science, but you will not find those specialists in
some of these facilities.
Yes, in some of these facilities. Then you'll go to the gym and then they tell you lift heavy things, and then you end up damaging your spine, or you don't know how to do it. But if you come to a physiotherapist first, they will tell you, if you lift a heavy object, bend your knees, lift with both arms, and then you do this. Or if you're going to do heavy lifting, use a lumbar brace or something to protect your back, so that at the end of the day, when you reach 60, you don't go for surgery. You are fine. But unfortunately, some people will go to the gym. I always see them, they bend, which is wrong. Because imagine you're on a top of a building jumping. That force of gravity that crushes someone, it's the same force that goes onto our spine every time we bend. So you see someone lifting heavy kanyama up and down, and they don't know they are damaging their spines. And then you tell them in the gym, please, can you put on a lumbar brace or something? Then they'll just laugh because they don't understand. So what I would advise our viewers, if you are to go to the gym, first go to a physiotherapist, then they take you through the techniques, and then...
Are these people available?
Physios, we are available. We are very many.
Because
some people have private practice like us.
I don't see physiotherapy.
Some people have private practice, like I'm one of them. Then you'll find physios in Mulago Hospital, or you'll find out in big hospitals, you'll find physiotherapists there. Then
So it's a government program to have physiotherapy?
Yes, even private hospitals they have.
Okay.
Then private practitioners, still we do physio. Just keep reading, what is physiotherapist?
And you go in?
And you go in, they will assess you, and then they will tell you what to do, even if it's just a consultation to know how is my body. There are patients who just see my signpost, Sonia Physiotherapy Clinic, they walk in, and then they say, hey, I was sick, I didn't know. Why? Maybe they say, I've been walking all the time, but I didn't know I have this problem until I walked in. Yes, please.
Very interesting. It's not painful, you don't have to be there all the time.
All the time now.
But
you can choose me to be your private physiotherapist. And you say, Irene, every month let me come to your clinic for physio. And then we reduce tension in your muscles.
Oh, you mean to say a person might need physiotherapy on a regular basis?
Maybe once a week, especially in elderly patients. For example, if you are...
Is that because they have a particular condition, or even a person
who is normal?
Who is normal?
Yes. Why?
Normal.
Yes, where I would think it's normal. For example, why should they need a physio? For example, I'm 70 years. There is that arthritis, there is joint stiffness. And then this person will tell you, I walk every day, Irene, I don't have any problem. Then you're like, okay, if you walk every day, let me test your sciatic nerve. You test it, they scream. Then you're like, but you told me you are exercising. Why is it hurting? Why?
Because you have manipulated it.
No, for example, I've stretched you. Stretching a normal stretch. If you're a person who walks, why should it pain? That means you are doing the walking in the wrong way. You don't first stretch, then you walk, you tone the muscles. When the muscles are toned, the lactic acid is there, it compresses on the nerve. And then when I come in to stretch, you are screaming. So we advise people, before any walk, before any exercise, first do the stretches, then strengthen your muscles, then after, stretch. And then take a warm water shower to just help your body relax.
Irene.
Yes, please.
Are there conditions where you would discourage someone from doing physiotherapy?
There are conditions that I would discourage massage.
Start with physiotherapy.
For physio, there is no way.
Where would you say,
reason being,
you have this? Let's not do physio.
No, for me, if, for example, if you have a stroke, you've just got a stroke, I would not touch you until the neurosurgeon say yes, because they would have done a CT scan and they know if you need surgery or not. You've got an accident which is really bad, maybe you have a broken bone. I would tell you go to an orthopedic surgeon first, they take x-rays, then after fixing you, you can come and I fix you again to be a better person.
So you work in liaison with
yes, we work
the
as
other
a
team members?
Yes, please.
Which conditions would you say massage should not?
Sciatica.
Why?
Because they can manipulate your spine in a wrong way. For massage therapists who are trained, I have no problem with them.
So if a physiotherapist
does
the massage,
it is okay because they know what they are doing. The majority, they know what they are doing. But if you walk in a massage parlor where our people are not trained in anatomy and physiology and they don't know anything about the nerves, I would say don't do it. Go to a physio. They might be expensive, but they can save you from getting maybe any trouble. Yes, please.
You know, that's really interesting. You know, there's a concern for some conditions. Parkinson's disease.
I love that.
Someone is like this. They can't even hold a cup.
Yes. A Parkinson.
What is your role there?
Our role is a lot with rehabilitation. Most of our culture, we think Parkinson is obuko. For example, I hug my father-in-law, then I'll start shaking.
I should never do it.
No way. Though maybe with culture it's part of that, but maybe for respect, that part of it. But Parkinson is the neurodegenerative disease. It's a disease that attacks the spinal cord. So I always tell people, if you start shaking, go and see a neurosurgeon, and then they will put you on medication as you do your exercises. Why we do exercises? Because it comes with stiffness. You'll find that the neck becomes stiff. You'll find that someone cannot turn. You can find the whole body becomes stiff. So if you are taking your medication, you are doing your exercises, there is no way you are going to become stiff. But the negligence comes in if you don't do physio. We don't have any physiotherapists to help you go through this condition. It might not be on a daily basis. You might come with your family member, and then I train this person what to do. Then you say, maybe a month, I'll go and see a physiotherapist to see whether I have any stiffness, how am I progressing. And then while you are taking your what? Your medication, either a neurosurgeon or a physician, they can help in that area. Yes, please.
Okay. So there's a role for physiotherapy.
Then even the tremors which are due to alcohol.
How are you going to deal with those?
Those ones I will refer to what? Psychiatrist or psychologist.
Psychiatrist.
Yes, I will talk to them that I have this patient, and they walk in and then they help them to rehabilitate them.
They can help.
Yes.
This is very interesting. We talked about hydrotherapy, we've talked about aquatherapy, which is actually the same as
water.
Hydrotherapy. Rehabilitation. You know, WHO says that a big proportion of patients, actually, they talk about a number that 75% of the total number of years lived with disability in the world are linked to health conditions for which rehabilitation is beneficial.
Yes, please.
You know, many of us have no idea about that. And I think it's because, I don't know why for a long time, physiotherapy is, why don't you come out so openly?
So openly. Because maybe sometimes we are not given platforms, or sometimes even the doctors themselves, they will tell a patient, go for massage. And then you're like, really? Why should a doctor who knows these things, because we go through the medical schools, you know, why should you tell a patient, just go for massage and then they massage your muscles? Tell a patient, go for physio, you'll do this and this and this.
I think it's because we confuse the two.
Yes, maybe they
we
also
think
need
massage and physio are used interchangeably.
Interchangeably, maybe that.
But looks like, maybe remind us again, what is massage and what is physiotherapy?
Massage is soft tissue manipulation. It deals with muscles to help with the blood circulation and relaxation. It does not cure you, or it does not help you to gain independence. But physio helps you to, it restores movement and function for someone who is affected by injury, by disability, by handicap, or impairment. So for us, we are there to rehabilitate you back to that normal person. You might not be 100%, but you might be 90%.
If I break my arm, you know we have bone setters, they manipulate. Is that part of physiotherapy?
The local ones, or?
I don't know.
No, for me, if you've broken your bone, I would really advise you to see an orthopedic surgeon, where they take an x-ray. If the surgeon says you'll need maybe a plaster on for healing for these particular months, but after those months, you have to go for physio because you will be stiff. Either you like it and then you end up with maybe the arm is bent forever. Yet when you finish they've removed the plaster, go and start on physio. It's painful. For example, if the arm is stiff, you will cry for a week, then you will recover your arm, and then you do rehabilitation for 6 months or 3 months, depending on how you can afford.
Now, women massaging men and the other way around. What is your take?
My take for women massaging men. For men,
you go home.
For women, for example, if there are those ones who are not professionals, I've just worked in the massage parlor, and this person's one of the jobs is to make the man fall for them, and then they pay money. There are those massage parlors I've not seen, but I've heard about them. Maybe my patients say, hey, I went to a massage parlor and this woman was behaving like this. So what I would recommend, I would be like for men, especially men, they hate a man massaging them. I don't know why, yet they are of the same sex.
We're going to
And
answer
then
that
women,
next time. You wait.
Yeah.
When we call you again, we'll go into that. But now, I want us to come up with like take-home messages for our viewer. What is your take-home message?
I would recommend tell my patients, if a physiotherapist doesn't need you to be sick, always working in a physiotherapy clinic, make sure your bones are okay, your nerves are fine. Don't wait for you to fall sick. Prevention is better than treatment. And then I believe that if you exercise, eat well, it's part of this takeaway home, control weight in your kitchen, and then make sure you are fit in the gym.
So that one means that there are certain risks or risk behaviors that might lead to conditions where you need physiotherapy.
Yes,
is that
especially stroke, obesity. If you eat wrongly, then if you eat red meat, we know of arthritis, uric acids, then you'll end up with gout. Gout is mainly due to diet. So how can we prevent that? Watch your weight, watch everything in the kitchen. Yes, please.
So that you...
Eat well, eat silverfish, mukene, it's really good for our bones. Imputa, tilapia, it's really good for our bones. But the tilapia might be expensive, but the silverfish will not be expensive. Chew them, don't fry them. Yes.
If someone has a stroke and they're looking for you,
yes, please.
Even if it's not you, Irene, just tell our viewer where they can find physiotherapists.
Physiotherapists, for me personally, you'll find me in Kansanga, near Didi's World. You'll see Sonia Physiotherapy Clinic. Then other physiotherapists, they are in Mulago Hospital, they are in other private hospitals, and then there are other private practitioners. Then you go on the internet.
Hospitals like regional hospitals?
They have.
Regional referrals. Do they have a provision for physiotherapy?
Yes, they have. There is every regional hospital has a department for physiotherapy. And also look on internet. You will find us there. You will know everything about physios. You can say, I need physios.
Let me tell you something. If you tell me to start using internet,
yes,
people are going to start massaging themselves.
Then they will not get the right thing because they don't know anatomy. No, what I was saying, look for physiotherapists on internet. I've got very many clients for me. They just search physiotherapist in Kampala. Then maybe I pop up, then they call my number or they call my clinic.
Would you strongly recommend that one should have a referral note to a physiotherapist?
Not really. Anyone can walk in the physiotherapy department. But it is also good to see a doctor if you have low back pain.
You know why I'm asking that? There are people who will just work on you as long as you appear, even if you don't have a condition that requires that.
That's why they need to assess you.
By the doctor or by the physiotherapist?
Even me, I can assess you when you walk in and you say, Irene, I'm sick. Then I will assess. If you don't have any problem, I'll tell you, Mr. Dung, you don't have any problem.
Really?
Yes, not to take your money. Then I'll tell you maybe what I would advise, go for exercises and then do swimming if you can, eat well, and then just go to the gym. But in the gym, be careful. Don't lift heavy, don't do this and that.
Now, there's something you told us that before you go to the gym,
yes,
first see a physiotherapist
yeah,
so that they advise you on what you're going to use.
Yes, please.
We have come to the end of our program. It's been really interesting and nice to host you on our program, You Health Chat. Until next Thursday, I'm Dr. Dungu, but up next is the news with Patricia.
Was brought to you by
You Health Chat is brought to you by National Medical Stores, world mandated to procure, store, distribute essential medicines and medical supplies to all public health facilities in the country.
Uganda
Sunday National Culture Center presents the second UNCC Annual Arts and Culture Festival, featuring Nanucha and the Planets, Afrigopan, Ragadi, Naikouma, Saranda Gire, and other live stage band performances, stage drama, art exhibitions, symposium, workshops, children's corner, and best regional cultural dance groups from Owachamazinga, Isiaba Masaba, Kelkwara Choli, Kararu, and Bunyoro Kingdom, among others. All happening at the National Theatre Kampala from Friday 1st to Sunday 3rd November 2019. Entry is only 5,000 shillings per day. Supported by